I can't sleep when I lay in bed. Too much thinking in my head. I don't know what to do anymore. But come on now, tell me the score. Is there anything I can do to get out of these tragic blues? I'm a victim of circumstance. I never really had a chance. I lay down and stare at my feet. You know the world has got me beat.
Hello, and welcome to today's edition of Mental Health Matters. Today we'll be featuring Teresa Ogan from Multi-Purpose Senior Services and Beth Heave, a professor at California State University. Beth is also a senior care consultant. Welcome to our show.
Thank you.
And I want to thank you for coming out and being with us here today. Could you please tell us a little bit about California Health Collaborative?
Sure. California Health Collaborative is a nonprofit based out of Fresno. We serve 54 of the 58 counties in California. And the goal of the collaborative is really to serve underserved and underrepresented populations in California. So we have a variety of health-related programs from maternal health, depression, anti-smoking, tobacco cessation programs, and cancer registry, as well as the multi-purpose senior services program.
Oh, okay. And how is the multi-purpose senior service program associated with the California Health Collaborative?
So the California Health Collaborative is the company that we work for, and we're just one of the programs that's under the California Health Collaborative.
Oh, okay. And what is the multi-purpose senior services program, and who is eligible for it, and what areas are served?
Sure. So the Multi-Purpose Senior Services Program, or MSSP, serves low-income frail seniors who are 65 and better. They all qualify for Medi-Cal with no share of cost. And this program serves all of Sacramento County, most of Yolo County, and the eastern end of Placer County, which is basically Colfax and below. And we do care coordination, case management, advocacy, and referral for seniors, again, who qualify for nursing home placement. And the goal is to connect them to the services they need to remain living safely at home.
Oh, okay, okay. And how does clients access you guys' services?
There are lots of routes in. So most of our clients are referred from outside providers like in-home supportive services, medical providers, social workers, home health, adult protective services, but they can also self-refer or be referred by family members or caregivers. So
have you ever had someone that was referred to you guys' agency that didn't meet the qualifications?
Yes. So the goal then would be that that we would refer on to at least 3 other resources in the community that would better meet their needs.
Okay, so if they did meet the qualifications, then you guys just don't just kind of kick them out to the curb. You
right.
Make sure that they get some type of services.
Right. We try to connect them to whatever service might be most appropriate.
Okay, okay. And what kinds of services can MSSP provide to enrolled clients? And does MSSP provide direct services?
We don't do direct care. We refer and connect to providers that do direct care, but we don't do anything hands-on. But we do work in an interdisciplinary team, a nurse and a social worker, as well as a care manager aide. All are connected to the client. There's a health assessment and a psychosocial assessment that's completed. A care plan's developed from those 2 assessments. And from that point forward, clients are they're contacted monthly by telephone and seen in their own homes a minimum of every 3 months. And we have a pot of funds that we're able to use to help purchase supplemental services to support the health and safety in their own home.
Okay, okay. Now, in your time, in your role, can you tell me, like, what's some of the challenges that you feel or you have experienced that some of the seniors face in our community?
I think isolation is huge. Isolation from other seniors, from family members, from other resources. Transportation, I think, is a huge issue for our seniors. And sometimes receiving adequate care at home is a big challenge.
Yeah, I know. I oversee a program, older adult program, for the agency that I work for, and that is some of the problems that our clients face: transportation, lonely, being isolated, being homebound, and a lot of them, because of that, they deal with depression, and sometimes because of depression, they attempt suicide. And so, have you ever experienced someone calling in that was really depressed because of that situation and, you know, talked about committing suicide? And how did you guys go about handling a situation like that?
Yeah, that comes up from time to time. We don't run into it a lot, but but it's not uncommon either.
Yeah.
And so we have staff, all of our staff have been trained in some of the procedures around, you know, talking to somebody who's actively suicidal. We have staff in our program who have managed or worked on suicide prevention hotlines, so we get them connected as quickly as possible to those people, but then also move on to referring them to the appropriate suicide prevention programs in the community.
Okay. So, for example, we get clients who need assistance from Adult Protective Services. You know, the senior population, a lot of them are very vulnerable, and they do get taken advantage of by, you know, people in the community. And how do you guys handle that if someone call in that's a senior and say that, oh, my loved one or friend has stolen my money or has taken my jewelry? How do you guys go about handling a situation like that?
So we're mandated reporters, so we would refer them on to Adult Protective Services. If they were clients of ours, we would assist them with connecting with the Adult Protective Services providers and providing any relevant information as able.
Yeah.
I think too many times our clients downplay relatives or caregivers that they, you know, feel they need to protect.
Yeah. Yeah, I know we had a situation where one of our clients called in and they were being taken advantage of by some grandchildren. And so what they really wanted, they wanted our program, me or one of the other staff, to just pretty much come out there and talk to their grandchildren and make sure everything is all right. But I explained to the client that we are mandated reporters, and we have to report this if, in fact, they're taking advantage of you, if they're stealing money, if they're stealing your jewelry. We have to take it a step further. And so the client, they said, okay, I'll think about it. And then they called back in a couple of days, and they kind of wanted their ice cream and cake and eat it too. They wanted their jewelry and their money back, but they didn't want their grandchildren to get in trouble for it.
Very common.
Yeah, and so that's definitely, and it's challenging.
It is, right. And I think that's, you know, Adult Protective Services personnel are great at going in and working with families. It's not their goal to place seniors, and so they, you know, they do a great job of going in and trying to find resources and answers, solutions for folks in those situations.
Yeah, absolutely.
Yeah.
So can you tell me what's the difference between direct services and referral services? And can you provide some examples?
Sure. Direct services are more things that are I think of as hands-on. So, you know, providing the transportation in your own car, doing a bath or respite service for the client yourself. And we don't do anything along those lines. We refer out for all of those kinds of services. And we have the ability to help supplement a lot of different kinds of referred services. So we're the payer of last resort. We would refer out to the community or free resources, provided resources first. And then if those aren't adequate, then we have the ability to help purchase some supplemental services. I think the most common things we purchase are transportation, paratransit passes, taxi rides for medical appointments. Bath service is pretty What else? Some safety equipment. We're really concerned about safety, so always looking at safety equipment.
Yes.
And things that help people be less isolated.
Yes.
So another thing that's really common is an emergency response system.
Okay. Now, we talked about transportation, which is a huge issue among the senior population. You know, what do you think we can do as a community here in Sacramento to really assist our seniors with transportation services? Because I know I facilitate 2 support groups a month, and that seems to be a topic that always come up every month. You know, and so, you know, we brainstorm and we've tried to come up with different ways to attack this problem, but it still seems to be an ongoing issue among the older adult population. So what do you think we can do as a community to really help our seniors out with transportation services?
It's very difficult because a lot of times there is paratransit that is available, especially in Sacramento. However, if you have someone that has a cognitive issue and they're told to meet at a certain corner, when they're finished with their appointment, they forgot which corner it is. And so even though services do exist, it doesn't mean that we can get the person the transportation that's needed.
Yes.
So many times we need the person to be with them to help them through the day. And so that's what's helpful. Of course, always additional funding is good, but again, the service does actually have to meet the need, especially when you have difficulties and barriers like that.
Yeah, that's definitely, you know, I really have a passion for the senior population. And, you know, our volunteers, they do provide transportation services to our seniors. But just like all of us, sometimes something comes up where they may want to go to the grocery store if the volunteer is not there to pick up some laundry detergent or some groceries, or they may have a doctor's appointment that just is scheduled right away.
Right.
And sometimes, you know, they have things that they need to do to, you know, to take care of themselves. But yet and still, the transportation services are not always available. And so, you know, I'm going to work with them and continue to work with them and help them advocate to try to get some type of funding for services, you know, from the community.
Right. Our local agency that does have some transportation is ACC.
Yes.
They were formerly known as the Asian Community Center and now it's Community of Caring. And they certainly do, but they serve certain zip codes because of funding limitations. So again, we have the difficulty if you don't live within those zip codes, transportation is an issue.
Yes, yes.
And I think it also requires us to be a little bit more creative and to be sometimes less concerned about who gets credit.
Yes.
Work together.
And to work together.
Work together.
Right. And to think, you know, time banks in some communities have been great programs, and that may be an answer for our community, is to develop some time banks where people are willing to go through some kind of screening and you know, be determined to be a safe provider and donate some time on their own to do some things like that.
I definitely agree with what you when you said, you know, collaborate and not worry about who gets the credit. I know when I first had knowledge of your agency, and I can't think of the staff name that I talked to, but she was very excited to hear about the services that we provide, and I was very excited to hear about the services that you guys provide. And so what we did was I sent her I think a referral form, and she sent a referral form from your agency over to me as well. And so that's what it should be like, you know, because the whole goal in mind is to provide quality services to the senior population.
Bottom line is the client.
Exactly.
And I have to say, within Sacramento especially, I do think the agencies do a good job of working together, because each agency is funded for certain things. You're not funded for everything. And so it's important, like Teresa and I have collaborated over the years, whether we've worked together or not, and shared resources. And that's the best way to serve the client, is for the professionals to be friends.
Yes. That's I definitely agree with that. Does MSSP receive funding to provide services for caregivers?
Very limitedly. We provide support to a certain degree to our clients' caregivers, but that's not the intent of our program, and we have limited funding to provide caregiver respite for our clients. But in general, we would refer out to adjunct resources and providers, one of which would be Del Oro Caregiver Resource Center. ACC would be one, the Community-Based Adult Services. But Beth is really the expert on caregiving.
Yeah, yeah. For the last 10 years, I've been involved with caregiver support. Okay. And a lot of the funds in, especially Sacramento County, come from the Older Americans Act, especially Title III-E. And that funding has been limited. In fact, it's actually been decreased over the years. But what it does is it provides for what we call informal caregivers, the caregivers that are not part of in-home supportive services. It provides support for them, such as respite. Del Oro was one that provided some caregiver counseling, those type of things. ACC provides support for those that English is a second language, caregivers with English as a second language. Mm-hmm. So it's definitely out there. Is it enough? There's so many caregivers out there that there'll never be enough funding, but that's why we appreciate shows like this, that we can get the word out and for folks to self-advocate as much as they can, and we can come along beside them as professionals as well.
Oh, yes, exactly. You know, so, and I think this is really important because you just touched on something key. You talked about the caregivers getting respite. Sometimes when caregivers actually start to provide services, it seems like their own needs are not getting met. And so they begin to, you know, provide services and just provide services until they're, you know, they're not taking care of themselves. Right. And they tend to burn out.
They sure do. The average age of a caregiver, normally a female, about 2/3 of the caregivers are female, about 1/3 are male. Average age is 48 years old. So if you think about a 48-year-old woman who's usually caring for one or maybe both parents, it's her prime earning years. Yes. So a lot of times she's given up her job to help care because that's what it takes to keep mom and her dad safe. And so she's not putting in the Social Security system at the time if she has a defined pension. She's unable to earn those credits as well. And so not only does it impoverish her currently, but it impoverishes her in the future. A need that has been met to a degree is, for a long time I was noticing caregivers that didn't have any medical insurance at all. If they were under 65 years of age, they weren't, of course, receiving Medicare. That is an improvement with the Affordable Care Act that is now available, because I would ask the caregiver, well, when was the last time you went to your doctor? She said, well, I haven't. I use the emergency room when I have to because I have no coverage. And so that is wonderful to hear that now they are able to have health insurance of their own. But yes, there is a lot of caregiver burnout. It's a very tiring job, sometimes misunderstood in the family. The one that is giving their very most is usually the most criticized as well. And I see a lot of times they're doing a wonderful job, but what can happen is there might be a sibling that comes out of state, visits for a while, and they decide there's a better way of doing it, and that can be very difficult and non-supportive of the person giving their all.
Yes. You know, it's interesting that you said that, because I was just talking to a friend, a close friend of mine that lives in another state. I think it was Saturday we was talking on the phone, and her mom had caught Alzheimer's, you know, before she passed. And so she was the primary caregiver, and she, you know, took care of her mom, pretty much did everything for her mom, and you know, she was burned out. Right. And so her sister came from out of town, from out of state, and she did exactly what you described. She felt like the mom can have another level of care other than what the sister was providing for her. And so they, you know, they kind of butt heads, and you know, so the sister ended up going back home, but she was offended at the fact that the sister that was providing care for the mom did not take her suggestions. And so, you know, I think that it should be really highlighted that, you know, caregivers they need attention too.
They certainly do, and family relationships don't change as we become adults.
Yeah.
And so sibling rivalry is still there.
Yes.
And sometimes exacerbated by the situation. And for folks to realize that they're on the same team, when I've been a part of a previous agency, I used to do family meetings. And if there was somebody out of town coming in, we would actually meet together and talk about, and I would support the caregiver for what they had been doing. And the family hearing that from somebody else is very good, because then they decide, hopefully they decide that maybe their sister is doing a great job. And I can describe the difficulties and without being an emotional affair between the two of them.
Yes.
So, in a very professional way.
Yes. So if I was a caregiver and you knew me and you noticed that I was getting burnt out, I was spending, you know, just unlimited hours taking care of my loved one, I wasn't really taking care of myself, you noticed I was cranky, you know, you just noticed that, Jesse, you're not yourself. What advice would you give to somebody in that type of situation?
Well, the advice for each caregiver is a little bit different based on their circumstances. First, I would always look into what are their resources. What do they have on board that they're maybe not tapping? Maybe we do have a very cooperative sibling that the caregivers, I'll take it, it's my responsibility, and they've been pushing aside. And so if a responsible sibling, come on down, you know, we'll do what makes you feel, as far as each person has their own talents is what I always look into. And so if I have multiple siblings willing to help, sometimes I have the Costco person, the person that's not going to change the son, that's not going to change the mom's diaper. So he's designated the Costco person, but there's something everyone can do and feel comfortable with to contribute. And so that's one of the things. Of course, I do suggest a support group. Some folks do well with that, the majority do, and there are so many of them. The best place to look on the internet locally is deloro.org, and they have not a complete listing, but quite a few. Alzheimer's Association has a lot of caregiver support, and even health providers like Kaiser does a lot with caregivers. So it's finding support. Respite. Respite is huge. And so depending on if the family can afford it versus can the person go on NorCal, in which comes in-home support, which provides some caregiving, or can, through the Older Americans Act, can we find some respite there? And what happens is the current seniors that are the old of the old, the 85 plus, they grew up in the era of the Depression and that, and they believe in the rainy day. They just have no idea it's really raining now. And so they're holding on to every penny, and they don't want to spend it. And so convincing that group of folks that are ineligible for in-home support and NorCal to spend their own money on caregiving is a very difficult thing. So it's available, but it takes a change of heart. And sometimes I would talk to the parents and convince them that this is a loving thing to do for their daughter. And usually they'll say, well, my daughter, she's fine with it. My daughter will say, absolutely not, I'm not fine with it, I need some help. But they needed an extra person there to help facilitate that. So, so that's a good thing. Exercise, encourage them to take a walk. And for those folks, you know, that say, hey, you know, how can I help you? For the caregiver to have something succinct that they say, as far as, well, I like to go walking, you know, every evening at 7 o'clock. Could you just come over and sit with Dad while I go for a walk? And so people do better with that, knowing what to do, rather than how can I support you? And I'll let you know.
So I think also that, because I've spoken with, I know a lot of people, believe it or not, but I've also spoken with someone from my church, and she had communicated to me when her husband had got sick and she was no longer able to provide the level of care that he needed. She did hire a caregiver to come in and provide services to him. But she started feeling guilty. She started feeling as if that, you know, as if she was neglecting her husband, you know.
Yeah. Caregivers feel guilty about everything.
Yeah.
And to get past that is to affirm her and what a wonderful job she's doing, and that she's there for the long haul. And to help her to be there for the long haul, you help with today. And today is giving her a break so she can get the rest. She can go get the groceries she needs. She can go to the doctor. And to convince the person that that is a way to stay in the picture. Because what happens if they don't get any services and they don't get any help, they end up placing them. And so that's not the goal of probably who you met in church.
Yeah.
So, right. And community-based services are wonderful, you know, such as Teresa's in that. But everything, we talk about collaborating together, everything needs to get better. Community-based services needs to get better, independent living, assisted living, and skilled nursing, because all of them are essential to keeping our seniors healthy and providing the best care for them. And so we don't fight against each other. We realize there's a lot of times that caregivers, they've been providing care 10 to 15 years.
Yes.
Because the medical community is doing a wonderful job of keeping them alive. But the cognition is the difficult thing. And so they're dealing with dementia many, many years, and sometimes with difficult behaviors. And it's in the best interest at sometimes to find alternative living arrangements and to let that caregiver know they've done an incredible job. So, and not to feel guilty. They're still a caregiver. They're still going and checking on the person, but that gives them more hands.
Yes.
So,
I definitely agree with that. It definitely takes a lot of people to get in and just help you know, kind of lighten that burden, so to speak. You know.
It does.
So how does MSSP service caregivers connect to their clients?
In terms of the services that MSSP can provide. So we usually identify it during our assessments or our home visits that we're checking in with the caregivers, in particular family caregivers or clients who have caregivers that are there most of the time or all of the time. Checking in with them to check for burnout and make sure that they're taking care of themselves, their health needs, their mental health needs, their social needs. And if they're not, offering them some respite so that they have a chance to do that. It's never enough, but to offer them at least a chance to do a little bit of that every week.
Yeah, I know. You know, sometimes we've gotten calls for family members who loved ones may have a severe case of Alzheimer's or dementia, and so I will have to explain to the caller that we don't provide that level of care, but we do provide resources, you know, and we can provide resources to assist them with getting that level of care. But, you know, have you guys ever experienced that just working in the field where, you know, a senior would have like a severe case of Alzheimer's and dementia, and you see a caregiver trying to provide services to this senior, but they don't have the education, you know, or just the skills to really help the senior out?
Yeah, I think that's a common issue that we see. And so part of our job is to help provide education, and to refer them to resources in the community that specifically do caregiving.
And there's a lot of workshop and classes on dementia and difficult behaviors because it is a difficult problem. So, so there are resources out there. It's just connecting the person to know that they're there.
Yeah.
So.
Yeah. That's important. How does the relationship between the caregiver and the frail elderly impact their care?
I'll take that one. Okay. Yeah, because the person has had a relationship, it's usually a family member, before their loved one needs care. And depending on if that relationship was healthy or not so healthy, it does carry on. And sometimes when it has not been healthy, it exasperates what's going on. And so you're dealing with not only the caregiving issue, but relationship issues as well. And so counseling, if available, is very important. So for that. and letting the person, giving them emotional support.
Yeah.
I've heard it described before, emotional support can be respite, because sometimes you just need to let it out. And when I would take a new client in, a new caregiver in, because that's what I did, is case management for caregivers, I would just let them spill it out the first time. I would take as much time as it needed for them to just get it out. And found that the rest of the time, once they felt heard, it went well for them.
Yeah.
And because so many times they don't want to express that, to the rest of the family. They're concerned, maybe somebody will report me if I have frustrations, those kinds of things. So providing a safe environment for caregivers to say, I'm struggling, but I'm still working on it, is just all right.
Yeah.
So.
Yeah.
I think too that there's a component of not judging, that sometimes we have staff come back and we feel really badly about a client who seems to be really isolated. Their family doesn't want anything to do with him. And there's often a story. There's a story in that lifetime that speaks to that we don't know yet. And it's important not to make or contribute to a caregiver feeling guilty because they're not doing enough, I think.
Right. There's a backstory many times. And I spoke to a local activity director of assisted living, and she goes, that's one of the things that's great about being the professional. We come in with a situation now and can accept the person. We don't have the history with them. So that doesn't affect us. And so it gives the person a second chance. That's a wonderful thing.
That's a great way of saying it.
And it is challenging when you take on a client and they have a loved one that's connected with them, and the relationship is kind of tumultuous, and here you're trying to provide the best services to the client, but then you got this loved one connected and everything is just not going the way that it should be. And so tell me, how would you actually address something like that? Because you do have the family member there, obviously, but you do have the client, and that's really the centerpiece, in this particular situation. So how would you handle that?
I think it depends on the circumstance. We always go with, it is our seniors. Our seniors have the right to decide. And we want to support that right to decide. It's their choice. They have the right to self-determine. And it's only unless and until a psychiatrist and a judge determines otherwise that that's not the case. And then we run into safety issues. And so balancing those safety issues with caregivers sometimes, trying to work with caregivers to make sure that seniors who haven't been determined not to have capacity are still safe. And sometimes that's a hard line to walk.
It is a hard line to walk. The one thing I always try to do is prioritize what the issues were. Safety is number one. And so that is something I will address with the caregiver. Some of the other things are not going to be as important. It might be just two generations colliding and having different values, that type of thing. But when it comes to fall risk, that's when I'm going to talk to both and encourage the caregiver to do the very best that they can do to prevent that fall. Because if the goal of the caregiver is to keep the person home as long as possible and safely, you're helping them. So,
And sometimes it becomes a point where we need to do an adult protective services report, and they'll come in and hopefully help both to navigate a safe solution.
One of the things that I was faced with when we took on a client, this particular client, when she got a volunteer to go out to her house, his first day on the job with her, she had confessed to him that she was depressed, and she communicated to him that she was going to commit suicide. So because of the training that he was provided to him, he was able to ask her a series of questions and really kind of dig deep. And so she explained to him that she gets depressed at the end of every month because that's when her benefits run out, her money run out. But she also communicated to him that she was paying for storage for one of her loved one, and she explained to her loved one that she does not want to pay for the storage anymore, but he refused to listen. And so because of that situation, she was actually thinking about commit suicide. So we had to go in there and we had to just kind of talk to her and just make sure that this is something that she wanted to do, and not pay for the storage. And so when we talked to the loved one, he was offended. He was highly offended. And so we had to explain to him that, you know, this is what your mom wanted, and, you know, and so it just was a very uncomfortable situation, but we had to advocate for the client because that's what we was there for.
Yeah.
And so those type of situations is very sticky and it's uncomfortable, but we know what we should be doing, and that's just to, you know, provide the services to the client, you know.
But you're also providing a problem solving.
Right.
Yeah.
And we can provide all the emotional support we want, but we don't help with solving some of the problems. The situation still exists.
Yes.
Right, and that can cause a vicious cycle. So really knowing what resources are, willing to talk with family in a very professional way, and can really move a case along and really improve the situation.
Yes. Yes. What do caregivers struggle with? What do you think caregivers struggle with?
They struggle with so much. In so many ways, they're our heroes because they work a lot more hours than you and I do. They're up in the middle of the night. A lot of times they've given up their lives for somebody else. And, you know, the first year or two, it's difficult. But when it goes on for long periods of time, you know, they can cut saying, did I actually choose this? Should I go on with this? What else is available? But I feel guilty. Back to the caregiver guilt.
Yes.
And so they do struggle with the commitment of their loved one because they definitely care. But I just can't go on. And so they get to those points, and I hope that they reach out as much as possible to services like Teresa's and Del Oro and ACC and Alzheimer's Association, everyone that's available to them, and to help support them, do some problem solving, and find those resources that will help them, especially get some time off. That's huge. Some caregivers have been at it so long, they don't know what to do with themselves when they have time off, that they want us to make them a list. So, you know, is it Starbucks? Is it the library? And because they've forgotten who they are and what their interests are. And it is something that they're not alone. There's many millions of caregivers out there who do it for short periods of time, but mostly long, especially in the cases of dementia.
That's what I was going to say, was that I think we oftentimes, when our clients pass on, that we may hear from caregivers and they just don't know who they are anymore.
You know. They don't. If they've left careers, they've been gone so long, it's hard for them to re-enter. If you think of the average age of a caregiver, then now they're into their 50s, maybe late 50s, trying to re-enter the job force for their own economic security, and they're kind of lost. And you ask, well, would you do caregiving? The majority of the answer is no. They did that for their loved one, but that was not a career choice. They did what was needed at the time. And so that's what I would say that they struggle with. And the caregiver guilt can go into other areas as well, as far as, like, even for myself, I support multiple generations. I'm a grandmother, you know, of almost 4 now, and I have my parents that are 87 and 90. I have my adult children, and a husband, and who do you spend the time with? And if you spend the majority of the time with one, you're ignoring the others, and keeping that balance is very difficult. One caregiver that I knew of, that she had not seen her new grandchild, and the grandchild was a year or two old, because lived on the East Coast. And those are the things I find heartbreaking, because we need to honor the caregiver and what's important to them too, because they're definitely a person that needs to be loved. Sometimes people are so concerned about the person they're caring for, they ignore the person that has given so much to them.
Yeah, yeah. You just touched on something else too, because that was one of the things that my friend had talked to me about. Was, you know, she had children, she had grandchildren, her fiance and her mom, and so she struggled with, you know, who she should spend time with, and she chose her mom above all because her mom was sick, and then she started to feel guilty because she felt that the rest of the relationships had suffered in her life, you know. But it is true that, you know, a caregiver does wear many hats other than providing services to the elderly. It is a mom, it is a, you know, wife or a husband or so forth. So, you know, and I think that, you know, that balance, you know, need to be there.
And sometimes what I ask myself personally is, the current situation a safety concern? Is it a crisis? There are times when all my energy does need to go there, but then I pull back once we're over that, because there's many crises with chronic disease, many crises, and then I have to pull back, and because, you know, I need to see the other members of my family and friends who are very important. And sometimes those you're caring with, it kind of upsets them because they're going to miss you. And but you need to do it anyway. So it's to get re-energized for the next hurdle.
Yeah. You know, one of the things, and it's just coming to me too, we teach a workshop at my agency called WRAP, which is Wellness Recovery Action Plan. And, you know, one of the things that that's taught in this workshop is self-care. And, you know, me just kind of thinking now, you know, there's several tools. We have Wellness Toolbox, and, you know, and the Wellness Toolbox is what do you do to keep yourself well? So, for example, exercising, running, you know, watching TV, whatever it may be, that's what will go in my Wellness Toolbox to keep myself well. And so I think that's a great way to really help a caregiver, you know, to remind them, okay, you know, you need to take some time and, you know, create something for you that will keep you well, you know.
Even if it's just, you know, 5 or 10 minutes a day, sometimes we talk to our caregivers about just take that little bit amount of time to meditate or to sing or to, you know, to do an art project, whatever that is. But oftentimes our caregivers feel guilty about taking it or state that they don't have time. And so, you know, they don't even feel like they can take that little bit of time. But if they did, that even just the 5 or 10 minutes would help a lot.
One caregiver I had previously, I loved what she did. She would go to her bedroom and she would think about a country she wanted to travel with. Too. And she'd think everything about the country and visualize the country. And when she got tired of that country, she chose another country. So she said she had traveled the world. And what a great perspective.
Yeah.
So, you know, we're all going to grow old. We know that we're all going to grow old. So is it okay to say that it would be a good idea for the family structure to come together? Like, for example, my mom, she's 67, and this is the conversation that my siblings kind of dread. You know, because mom, she's going strong. She's, you know, but, you know, there are some challenges there, you know. And so, you know, one of the things I've been thinking about is kind of trying to bring this subject up again with them is, okay, we need to kind of get together and talk about who is going to do what, who's going to be responsible for doing what, who's going to be responsible for handling the finance, who's going to be responsible for actually if she need a shower, bath, you know. So is it safe to say that, you know, or is it a good idea to say that we as a family unit, we should have this structure already in place? You know.
What I would say is keep your family close.
Yeah.
Families that are doing well now will do well in caregiving as well. You don't know what's going to come up in the future and what kind of care, or you might not need to have care at all for mom. And so, and of course, if her legal paperwork is not done, that's what I would encourage to do, is to have her do, because she's going to choose who she wants for the finances and that, and have her choose Not everyone gets dementia, but a lot of folks do, especially after the age of 85.
Yeah.
And so if she can choose at a time where she's of sound mind, that's the best time to do it, right? When there's not a crisis.
It's never too early.
Yes.
Yeah.
Okay, so, and I know you touched on some of the resources that's available for caregivers that's in the community, but do you know any other resources that's available to, the caregivers that's in the community? Yeah,
we talked about the health systems. That's a place to check. And the associations with, like the Stroke Association, Alzheimer's, ALS, some of them are disease specific, and that's another place. And again, I would check the Del Oro's website. It's deloro.org for a pretty complete listing. They try very hard to do that. And so I'm trying to think of others. If you're heading the way where the parent or a spouse is older and they're low income, I would actually suggest that folks apply for Medi-Cal. And within home supportive services for that to be in place.
Yeah.
So.
I know that if a spouse, husband or wife was like in the military, I know that they may qualify for like VA benefits, and that's a way, you can pay for, caregiving, and so that's another way too.
Yeah, the VA health system actually has quite a few services, and I was quite surprised to find that out. The local VA health system, if somebody is a veteran, they can have their own health. They can be a Kaiser patient as well as being a VA patient. And by going once a year to the VA, that hooks them up to some social services available through their primary care. So I would encourage all veterans to do that. They have one favorite resource of mine. It's called the Home-Based Primary Care Clinic. And that's when a veteran becomes homebound. The services actually come to them.
Oh, wow.
Such as the doctor, the nurse, the physical therapist in that. So it's different than home health. It lasts a little bit longer, and then the caregiver doesn't have the problem of getting the person that's maybe bedbound, trying to get them to the VA health system, or trying to always have home health involved. So it's a great thing.
Yeah,
so.
it's a great program. And our clients in our program can also receive that program.
Okay. What are the steps involved in enrollment, and how long does it take?
Well, unfortunately, we have quite a long wait list right now. So our wait list is about 6 to 12 months right now. We have the ability, depending on acuity of need, to move somebody up the wait list if there's no other resource and it's urgent. So once they reach the end of that time period and they've reached the top of the list, then a primary case manager would call them and schedule an enrollment. It would either be an initial health or an initial psychosocial assessment. So all clients are seen by both a nurse and a social worker initially. They both do an initial assessment. We bring that together and develop a care plan. And from that point forward, then clients are contacted monthly.
Okay. So, and I... Once again, that need is great. I know even when our program, we do tend to have a wait list, because our program is geared around volunteers who provide the services for our clients. And so there is a wait list at times for, clients to receive services from the volunteers. And so it really is a really huge need, and I think a lot of times people in the community don't realize that how great of a need it is for the senior population. A lot of them feel like, when there are a wait list and they don't get the services right away, they feel like they have been forgotten. And that's not always the case. It's just that we got to get things together on our end to make sure you can get the quality service that you're waiting for, so to speak.
Yeah, and I think, what we forget is that the baby boomers have hit 65 and older. And by the year 2060, people over the age of 65 are expected to double in population in the United States. And the funding has not followed yet, anyway. Hopefully it will. But, we're not growing our programs fast enough to keep up with the aging population, caregivers who are serving the aging populations. And so again, it comes back to doing that coordination with other providers in the community. Because we have such a long wait list, we would also recommend some other programs. Sutter PACE is a great program. Sometimes people aren't interested in giving up their caregiver or giving up their physician to go to Sutter, but you know, there are other programs that do some similar things, and so we would try and connect people to those resources as well.
And I would say don't give up.
Yes.
Yeah.
As family members, don't give up. If you're put on a wait list, it's just okay. Don't say no.
Right.
Go ahead and get on that wait list.
Yeah.
And sometimes it moves a lot faster than we expect, and
Right.
that's always a pleasant surprise. So
Yeah.
keep trying.
Yeah.
Yeah.
Well, how does someone get in touch with you if they wanted to know more about your program or have referral questions?
Yeah, so they can contact our main number, which is 916-374-7739. They can also check out our website, which is healthcollaborative.org. And people can send me an email at togan, O-G-A-N, at healthcollaborative.org. I know that's a lot.
Okay. And Beth, what if someone want to get in contact with you if they just have questions about caregiving, if they needed to know about resource referrals and ground to caregiving, how would they get in contact with you?
Certainly with this showing, and what I would say is have them go through the California Health Collaborative.
Okay.
I'd be happy to do so. I do give presentations in the community, and I'm happy to tell the collaborative when that happens, and so they can advertise that as well. But would be happy to help, and we can use the same number.
Okay, okay. What about next steps?
I think next steps, one of the things that I am passionate about is intergenerational programming, and really looking at how do we bring communities together to help, you know, serve each other. There's a big need to reach out to kids in the community, and there's a great need to reach out to seniors in the community. And how do we bring those together to help support each other and learn and give to each other?
Okay. Okay.
Yeah, and we would also love to see caregiver support be available right at MSSP.
Yeah.
So certainly collaboration is wonderful, but when you have something under your own roof that works well, because it's very accessible and you can meet the need quickly.
Okay.
Right.
So are there gaps in the community for caregivers?
Yeah, there are gaps in the community. As we mentioned, respite is so much of a piece of what we need to do for caregivers. However, there is not a lot of it available. There's some available. Teresa mentioned a little bit, if qualified through MSSP. The Older American Act does fund a couple agencies in this area, but it's limited. A person does not, once they receive respite, it doesn't continue on because so many people need it and want it. They rotate on and off as far as being able to receive it. So respite funds is huge.
Okay. Well, where are the gaps in the community for low-income, frail seniors?
I think there are a lot.
Yeah,
I think the funding hasn't followed
Okay.
the aging population. Transportation is a huge issue for seniors in our community. And I think housing is also a huge need. We're seeing seniors on wait lists for low-income senior housing for 2 to 2.5 years. So I think a lot of that is solved by funding, and some of that is solved by better collaboration within the community.
Yeah.
Right, and sometimes, well, not sometimes, it's a huge issue, is there's a lot of low-income seniors that are just above the poverty line that cannot receive the Medi-Cal, the in-home support, the things available for the very low income. And so they don't have enough money to purchase the services they need, and they have too much money to receive any services. So those are the ones that don't receive any help at all. And those are truly the ones struggling the most.
Yeah. I know, when we do go out there in the community and provide services at our support group, that's definitely a concern for some of our seniors is their income level and certain things they cannot afford to buy. They can't get, you know, and so, you know, it's just one of those issues that we as a community, we should try to address it,
Right.
you know, because all of us, once again, we're all going to get there.
We're all going to get there.
And
Yeah.
I would love to see these services increase as I start to age, you know, and
Yeah.
so, yeah, that's important. So what's next for us as a community? What's next for us as a community to provide services for the seniors? Just a quick question because we're running out of time.
Well, what I see is we're looking at a refugee crisis,
Okay.
and whether it comes to more to Sacramento, we need to be prepared.
Okay.
And Teresa's agency, I think, is going that direction, and with some cultural competency, and so that's very important to understand who we're going to serve. So if you want to carry that more.
Okay.
Sure, yeah, we're hosting a cultural competency training on serving the refugee communities from Afghanistan, Syria, and Iraq on November 8th, and if anybody's interested, please feel free to contact me about that.
Okay, okay. Well, I thank you for being on our show, and thank you for watching this month's episode of Mental Health Matters. If you enjoyed our show and if you want to know more about this program, please contact us at area code 916-366-4600. Thank you.
When I think of where I've been, the good times and the bad, on a scale of 1 to 10, either way I'm glad, 'cause I'm not alone. As I'm reaching for the phone, your voice is there, you really care, you're my comfort zone. Sometimes when I'm lost, crushed beneath the pain, though I can't afford the cost, I just smile and play the game. There's a healing place where I cannot pretend. Your smiling face, your heart's embrace heals me again. So even when the storm is strong and I'm deaf to my own cry, I faintly hear a distant song, and I simply can't deny that I'm not alone. 10,000 times I've known my best bet is that first step for hope. Trying to stand tall, I'm haunted by the past. With my back against that wall, one thing is clear at last. The kind of love you show to me flows from an endless stream, with shores so wide it won't subside. My mind had never dreamed how I'm not alone, even when I'm on my own. Your gentle touch is much too much to let me roam. So even when the storm is strong and I'm deaf to my own cry, I faintly hear a distant song, and I simply can't deny